Okay, so you're gonna get called code 4 to a residential street. There's a 35-year-old male who got ejected from his vehicle for I negative.
Okay, so today's daytime weather.
Yep.
Okay, so it's a little cold, so I'm gonna wear a jacket so I stay warm. Bring a blanket for my patient so he doesn't get hypothermia. It's slippery, so I'm gonna wear ice cleats and bring salt to melt some of the ice. It's dark, so I'm gonna have high vis on, and I'm also gonna make sure that I have floodlights on, and I'm gonna request police for traffic control because streets can sometimes get busy. Mechanism of injury was a collision involving an ejection. Sorry. Casualties, only one known thus far. Ally is going to request fire to stabilize any vehicles and to clear any debris, and police again for traffic control. And PPE fry was negative, correct?
Yep.
So I'm just going to wear my standard PPE. So we get to scene, we get out of the ambulance. Are we greeted by anybody?
Yeah, his sister.
So hello, my name is Julien. This is my partner Aiden. We're both paramedic students. What's your name?
My name is Madeline.
Madeline. It's nice to meet you, Madeline. Can you tell me a little bit about what happened today?
So my brother, he was backing out of the driveway, and I don't think that he was wearing a seatbelt, but there was this car that was zooming by, and it hit him, and he got ejected from his vehicle.
I'm sorry to hear that, Madeline. What's your brother's name and age?
His name is Nick, and he's 35.
Okay. And have you or Nick, Madeline, had any new or worsening symptoms of diarrhea, vomiting, fever, chills, shortness of breath, or cough?
No.
No. And did you happen to notice if he hit his head, neck, or back at all?
He definitely did.
He did? Okay. So, can you take me to your brother, please, Madeline?
Yep, and she brings you to me.
So, upon first initial appearance from distance, I'm looking at the casualty. Do I notice if he is interacting with the surroundings? Is he appearing like this, laying supine on the ground?
He's laying supine and he's not interacting at all.
Okay, and looking at his breathing, do I notice chest rise, chest fall? Do I hear any adventitious sounds?
No sounds, and the chest rises and falls.
Okay, and looking at his circulation, what's the color of his skin? Do I notice any diaphoresis, any blood?
No blood, no diaphoresis, and the color is pale.
Okay, so we'll have you grab this strip. So we're going to approach the patient from the front, just because we're taking SMRs. So I'll approach the patient. Hello, my name is Julien. I'm a student paramedic. This is my partner Aiden. It's important you don't move. What's your name?
No response.
No response. Okay, so I'm going to approach. Partner, I'll get you to get ready to pulse. Hello, my name is Julien. I'm a student paramedic. Can you hear me?
No response.
No response. Okay. Doing trap squeeze. Hello, sir. Can you hear me?
No response.
Can you open your eyes?
No response.
Okay, gonna do a quick interview check. Hold C-spine, please, partner. Check the blood. Do I notice any medical alert bracelets?
Nope.
Okay. Feeling the carotid and the radial pulse. What's the approximate rate, rhythm, volume, and what's the temperature of the skin?
Temperature is getting cold, and the pulse is regular and strong.
Okay, partner, I'll have you open up the airway with the jaw thrust. Looking in the airway, do I see any blood secretions, any broken teeth?
Nope. You don't
Okay.
need to see.
I'm looking for chest rise, chest fall, listening for breathing sounds.
Chest rises and falls.
What's the approximate rate, rhythm, volume, effort?
It's normal.
Normal, okay. I'm gonna put this on my patient because he's getting a little cold. And this patient is a load and go due to the mechanism of injury. They were involved in a motor vehicle collision involving an ejection. So I'm going to start my rapid trauma survey now. So I'm feeling the head for symmetry and stability, and checking for blood. Do I see any blood? And stability, symmetry, palpating the orbitals, the jawbone, feeling for stability, symmetry, looking in the nose, mouth, and ears for cerebrospinal fluid, blood secretions, checking the pupils for equal reactiveness. Okay, I'm checking the front of the neck for JVD, subcutaneous emphysema, tracheal midline, and any tracheal tugging.
None of that.
Okay, and I am feeling the back for tenderness, instabilities, cervical spine. Pardon?
It's unstable.
It's unstable. Okay, partner, I'll have you apply the C-collar there. Okay, sir, I'm just gonna lift your shirt up so I can inspect your chest and abdomen, okay?
No response.
Okay, so I am palpating the clavicles. Do I feel tenderness and stability?
Nope.
Okay, palpating the sternum, feeling for tenderness and stability.
It's good.
Palpating the chest, feeling for any fractured ribs, any instability. Do I have any paradoxical movement?
It's good.
No paradoxical movement?
Nope.
Okay, I'm looking at the abdomen. Do I see any discoloration, swelling, tenderness?
Nope.
Okay, I am feeling for a pulsatile mass.
No pulsatile mass.
Okay, I'm gonna palpate, looking for any grimace, any feeling tenderness and stability.
There's no tenderness and there's no grimace.
Okay. I am feeling the pelvis. I'm pushing down and in. Do I feel tenderness and stability?
No tenderness, no stability.
No
Actually, yes,
tenderness?
yes.
Okay. All right, partner. I'll have you grab the sagger and we'll come stable this pelvis. Also, putting my hand over the bladder, feeling for any incontinence, any tenderness and stability.
Nope.
Okay, sir. This is gonna hurt. All right.
No response.
Okay, and I am palpating the lower extremities and then for tenderness and stability.
It's good.
Feeling the bilateral pedal pulses. Do I got equal bilateral pedal pulses?
They're equal.
Checking the cap refills. Are they under 2 seconds?
Under 2 seconds.
All right, sir. Push your feet down like you're pushing a gas pedal.
No response.
No response. Okay, sir. What toe am I touching?
No response.
No response. Okay. I'm moving up to the upper extremities. Feeling for tenderness and stability.
None of that.
Okay, feeling bilateral radial pulses.
They're equal.
They're equal, okay. Feeling the cap refills, pressing the cap refills, are they under 2 seconds?
Under 2 seconds.
Sir, can you grab my fingers?
No response.
Sir, what finger am I touching?
No response.
No response, okay. I'm gonna palpate as much of the lower spine as I can. Looking for blood as well. Do I notice it?
No blood.
Okay. And upon when we backboard the patient, I will look at the rest of the back. And so for this patient, he is a load and go due to the mechanism of injury. He was involved in a motor vehicle collision where he was ejected from the vehicle. He had a GCS of 3, eyes 1, verbal 1, motor 1. The abnormal findings were instability, deformity in the cervical spine. We had instability in the pelvic region, and he was a little pale and a little cool. And for the critical interventions, we had manual SMR, we had pelvic stabilization, and the chief complaint, the patient was unconscious.